Good evening. The only way I can top that is somebody needs to fall over and I can save you. Wow, was that amazing? Well, I'm Dr. Sidney Smith. I'm a local dermatologist, so a local boy, and I want to do a little shout out to some of my patients I've seen here earlier up in the back row. And for those of you who don't know me, I'm looking forward to seeing you as patients. Tonight, I would like to share some stories with you. I'd like to introduce you to an innovative and new way of looking at medicine. To do that, I have to share 3 stories. I got to share my story as a child. I've got to share the story of 2 of my patients. And I also have to share the story of medicine. Now, you know medicine, but I'm going to tell you a medicine that you don't know, that maybe you wish I had not told you. So, here we go. I grew up in Atlanta, and every fall we used to go to the fall festival. And at that fall festival, I always wanted to win one of those big dolls. You know the kind of dolls you put on your shoulders? Y'all familiar with that? You'd wear them at the festival all day long. But see, I wasn't any good at shooting that basketball. I wasn't any good at shooting that BB gun. And you know how they have that softball and you have to throw at those lead-lined milk bottles and knock them over? Well, I couldn't do that. But my chance occurred. I was walking down the midway, and there was a fella in the balloon dart toss game. He called out to me, and he had his hand on this big doll. He said, "Son, $5, 3 darts, and you'll win a prize." I thought, this is my chance. This is the doll I wanted. Okay? You've been there. Walked up there, put my $5 down. Mom and Dad were with me. I got 3 darts. 1, 2, 3. Missed every balloon. Not only did I miss all the balloons, I swear that wood was made of cement, not a dart stuck. Fell to the ground, but didn't matter. Didn't matter. You see, because he was holding that prize. So just as I was reaching up to grab that prize, his hand reached underneath the counter and pulled out a piece of plastic, and it was a bird collar. I was like, oh my God. I assumed that he said a prize, and that was the prize. But the reality was a whole lot different. Now, here's the tragic part for you. Your health insurance is a lot like that. Okay? You're laughing because you know it. You know this is true. And to illustrate this, I need to introduce you to 2 patients. All right, I know what you're thinking right now. Dr. Smith takes care of some sexy, good-looking people. It's true. Let me introduce you to him. This is Miss Sonia Garrison. She's on the left. She's 84 years old, has metastatic melanoma. Started on her chest. It was excised only to recur underneath her arm and into her lungs. That handsome young guy on the right with all the good-looking attitude looks a little bit like me. That's my dad. My dad is 87 years old. He's living with metastatic prostate carcinoma. Started in the prostate, only to find out it spread into his bones. Now, Miss Sonia and my dad make an assumption. You see, they assume that when the physician writes a prescription, that the insurance is going to pay for it, for their cancer. They also assume that when a physician takes a biopsy of their very body, it's not going to get lost. Miss Sonia, she's being treated with Keytruda. She's doing great, okay? Keytruda, you're familiar with Keytruda because President Carter has had metastatic melanoma for 6 years, and he's still alive. Her Keytruda costs $38,000 a month, $456,000 a year. But she made a good assumption, all right? She got the doll because her Gerber Life pays for that. That's great. My dad, he didn't make such a good assumption. You see, he's got Aetna Life. He's on Xtandi, it's an oral treatment for prostate carcinoma, $189,000. It doesn't cover it. But thankfully, there's a grant program that allows him to have access to that. Mrs. Sonia, she had a biopsy, came back in short order. My dad, again, not so lucky, took over a month to have his diagnosis come back. Can you imagine waiting a month to find out whether you have cancer or not? My gosh. But guess what? He's lucky because 1 out of every 1,500 of you, we lose the biopsies. Gone. Like a $2 pair of shoes on Amazon, just gone. Okay? I'd like to offer you this thought. The assumption is that your health insurance will pay for the most up-to-date, best modern miracle treatment for your condition. Number 2, you think that your healthcare team can actually communicate, talk to each other. Okay? Ask my dad. Ask about assumptions. And I heard you guys laughing. You know what I'm talking about. So here we go. You already know, and it is so clear that you already know the answer to this. Right in that chair, you have the solution to medicine that nobody else even thought of. And I'm going to prove it to you. You see, every time you interact with Amazon, Google, FedEx, and Uber, you use the solution because they're all built the same. They're built to track an event with a tracking number linking communication. Really pretty simple. And matter of fact, you're going to use this a lot because you're ordering Christmas presents, right, on Amazon. Well, you're going to do it a lot. So here we are. FedEx. We're all very familiar with FedEx. So let me just walk you through it. So you get a package. It's from Pottery Barn. You get a tracking number and a little app, and you can track it from the warehouse to the plane, all the way on the van, right up to your front door and get a picture. Okay? Now, we're all familiar with that. Now, here comes the dangerous part of the talk. I want to make sure everybody's ready. I want you to lean back in your chairs because I can't have anybody falling out and me being liable for it. Here's the part. Medicine has no tracking number. None. Now, that's interesting because the most successful companies in the planet have all tracking numbers, but medicine has no tracking number. Okay. It's not anybody's fault. I mean, medicine created the electronic medical record 52 years ago. Now, that was before FedEx, Amazon, Google, and Uber. We created it to track your name, date of birth, and social security number. Now, we all have records. We have records at the hospital. We have records at the doctor's office. We have records at the lab. We have records all over the place. Now, you know these things don't talk to each other because what? Every time you go to the doctor's office, you fill out the form. You go to the hospital, what do? Fill out the form. So why don't these things talk to each other? So how does the doctor get the records from the hospital? All right, now here's the real part. Nobody fell out on the first one, but you might fall out on this one. You ready? Doctors and hospitals use an invention that was patented 179 years ago. Honest to God. 179 years ago by Alexander Bain. It was patented in 1843. It's called the fax. So picture this. Picture this. Today, when you go to the hospital or your physician's office, we use a 52-year-old storage system on top of a 179-year-old way to talk to each other. That's the state of the art. You would have thought, I would have thought, that in 1971, when FedEx was founded, we would have upgraded 1994 with Amazon, surely by 1998 with Google, and then surely by 2009 when Uber comes along. Never did. Doubled down. So here's the question we need to ask ourselves tonight. The question I ask myself, what would medicine look like if it imitated Amazon, Google, FedEx, and Uber and actually tracked a biopsy, a prescription, and linked the communication? I asked myself that 10 years ago, and I invented it. It's called medical event tracking. And let me tell you why. Because I got tired of my patients falling into the big medical black box. Every one of you has probably experienced this. So when I have a patient and I do a biopsy, I got tired of that biopsy leaving my hands. I hope the courier got it. I hope it got to the lab. I hope they read it. I hope I got the results back. I hope I called you. I hope you got treated. That's a lot of hope. A lot of hope. So 10 years ago, I said, you know what? We're going to change this. And what we're going to do is we're going to make something a little bit more like FedEx. FedEx for medicine. So let me tell you what happens in my exam rooms, and some of my patients can tell you this. You're sitting there in my exam table. I get a biopsy that I think may be cancer. I send you an app and a text, and it says, Dr. Smith just created a biopsy for you. You put on your clothes, you're driving home, and all of a sudden you get another text, and you say, whoa, Dr. Smith, your specimen has just been gone from Dr. Smith's office on the way to the lab. You're eating dinner, you get another text, and it says, your specimen just arrived safely at the lab. The next day, you get another text, and it says, we're processing your specimen, and then I call you. Then what we do is we send you a text when we call you, when we schedule you, and when you're completed treatment and everything's all done. We've done this over 500,000 times. And every major lab in the country is now adopting this type of concept. But this concept, when it's applied to every aspect of medicine, is going to change and going to save your life. You see, medical event tracking will eliminate all lost specimens. Never happen. Number two, it will eliminate failure to call you and let you know what your diagnosis and treatment is. Now, here's something. I know this is going to be successful and all over the country because of Flow. You know Flow? You know Flow, Progressive Discount Car Insurance. Well, there's 2 medical malpractice companies that now offer discounts just like Flow and discounts for drivers. They offer discounts to hospitals and physicians to put in tracking systems that improve efficiency, improve safety. We all benefit. Today, neither you nor your physician knows if an insurance company is going to pay for your medicines. Even if an insurance company will pay for your medicines today, there's no guarantee they're going to pay next year or next month. Even if your insurance company is paying for your medicines today, some of you are still struggling with the cost. Tracking what your insurance companies are paying for in your medicines and sharing that information with everybody in this audience is going to empower you to choose a better plan that covers the cost of your medicine. Also, if you have a disease, let's say multiple sclerosis or cancer, it'll allow you to choose a better plan that covers your disease. Simply knowing what an insurance company will pay for will decrease the 12% of Americans declaring bankruptcy every year because they can't afford their medicines. It's amazing. Medical fraud. You hear about it in the news all the time. It's a $234 billion expense. Now, insurance doesn't work like your credit card. You get a fraud alert when somebody's using your card in a strange country, in a strange land for strange stuff, but it soon will. In the very near future, we're going to be tracking the outcomes of every single physician for diabetes, cholesterol, triglycerides. We're going to identify the best docs, and we're going to share what they're doing with everybody so everybody in this audience will get the very best care. And the last thing is all of this information flows through your hand so that you have all your records. So when you go to the hospital, you're not going to need the hospital's portal. They need your portal. That way you can take it wherever you go. So you see, in my hands, I see this saving patients every single day. I need this for Miss Sonia because I need to make sure she stays on her Keytruda and stays alive. I need this for my dad sooner than that because I need to make sure he can choose the right insurance. And lastly, most importantly, I need this for all of you because there's a festival going on right now. You may not know that, but it's called open enrollment. All right? You're in it. You're in the middle of it. On the left-hand side, I got Humana Booth. On the right-hand side, I got Blue Cross Blue Shield. And each of those guys have their hand on that big doll. all right? And they're telling you about all that insurance and all the benefits and all this kind of stuff. I just want to make sure that when you put your $5 down, that you actually win that big doll. Thank you.